Prostate cancer. There are over 40,000 men diagnosed every year in the UK, and it's the most common cancer in men. 1 in 8 men will get prostate cancer, but early diagnosis is key, as 65% of patients still present too late for surgical intervention. So here are the facts. 95% of all cases occur between the ages of 45 and 80. You are more at risk if there is a family history, for example your father, brother or uncle have been diagnosed in the past. And it's more common in African, Caribbean and Asian men. The symptoms: weak or interrupted flow of urine, passing urine more often, especially at night, difficulty starting the flow, feeling that the bladder is not completely empty, blood in the urine or semen, nagging pain in the back, hips or pelvis. If you experience any of these symptoms, even if it is only one, then please go to get it checked out at your own GP. Testicular cancer. This is a relatively rare cancer, with around 2,000 new cases diagnosed every year in the UK. However, it is on the increase. Now, the facts. The most common age to be diagnosed is late teens to early 40s. If there is a family history, then you are 10 times more likely to develop it. It sometimes occurs when the testicles haven't descended, and it's more common in white men. Symptoms to be aware of are a painless lump, hardening or change in the size of the testicle, pain in the testicle, dull aches or heaviness in the scrotum, groin or abdomen, a sudden collection of fluid in the scrotum, blood in the semen. Penile cancer. It's extremely rare, with around 500 cases diagnosed each year in the UK, and most men diagnosed are over 60. Some of the risk factors include an HPV infection, or a type of virus that causes penile warts, smoking and not being circumcised. The symptoms to be aware of are a growth or ulcer on the penis, changes in the colour or skin thickening of the penis, persistent discharge, unexplained pain in the shaft or tip of the penis. When diagnosed, early penile cancer is very curable. So with all these cancers, prostate, testicular and penile, early diagnosis is vital. So if you have any of these symptoms, please visit your doctor without delay.